Laboratory work is prescribed for a client who has been experiencing delusions. When the nurse approaches the client to obtain a specimen of blood, the client begins to shout, "You're all vampires. Let me out of here." Which nursing response addresses the client's anxiety? 1. What makes you think that I am a vampire? 2. I'll leave and come back later for the specimen. 3. Do you remember discussing the lab work earlier? 4. It must be frightening to think that others want to hurt you. Answer. 4. It must be frightening to think that others want to hurt you. Rationale. The correct option helps the client focus on the emotion underlying the delusion but does not argue with it. Avoid statements that place the client in a position that requires a response. Attempting to avoid the situation will not address the client's anxiety. The incorrect responses may cause the client to hold the delusion more strongly. The spouse of a client admitted to the mental health unit for alcohol withdrawal says to the nurse, "I should get out of this bad situation." Which is the most helpful response by the nurse? 1. Why don't you tell your spouse about this? 2. What do you find difficult about this situation? 3. This is not the best time to make that decision. 4. I agree with you. You should get out of this situation. Answer. 2. What do you find difficult about this situation? Rationale. The most helpful response is one that encourages the client to solve problems. Giving advice implies that the nurse knows what is best and can foster dependency. The nurse should not agree with the client, and the nurse should not request that the client provide explanations. A client whose wife recently died of cancer says to the home care nurse, "I can't believe that my wife died yesterday. I keep expecting to see her everywhere I go in this house." What is the therapeutic nursing response? 1. It will take time to adjust to your terrible loss. 2. It must be hard to accept that she has passed away. 3. Try to focus on the fact that you and your wife loved one another for years. 4. Focus on the fact that her suffering is over and that she had a good life with you. Answer. 2. It must be hard to accept that she has passed away. Rationale. The therapeutic nursing response is the one that recognizes the difficulties of grieving the loss of a loved one and that facilitates expression of feelings. The remaining options are not therapeutic because they do not encourage expression of feelings. The mental health nurse is meeting with a client who has a long history of abusing drugs. During the session, the client says to the nurse, "I'm feeling much better now, and I'm ready to stop using drugs." Which response by the nurse would be therapeutic? 1. You have said this many times before. 2. Tell me what makes you feel that you are ready. 3. I'm so glad to hear you talking this way. I will let your psychiatrist know. 4. I need to see changes in you to believe that you are ready to stop using drugs. Answer. 2. Tell me what makes you feel that you are ready. Rationale. Clients with a long history of drug abuse need to demonstrate motivation to change the behavior, not just verbalization of the behavior. The therapeutic response by the nurse would be directed at assisting the client to look at the behaviors that indicate the change. The correct option is the only one that will provide this direction to the client. A client who has just received a diagnosis of asthma says to the nurse, "This condition is just another nail in my coffin." Which response by the nurse is therapeutic? 1. Do you think that having asthma will kill you? 2. You seem very distressed over learning you have asthma. 3. Asthma is a treatable condition when medications are taken properly, so let's practice with your inhalant. 4. It will be difficult to work with you if you can't view this as a challenge rather than a nail in your coffin. Answer. 2. You seem very distressed over learning you have asthma. Rationale. Clients who have learned that they have a chronic illness may exhibit denial, anger, or sarcasm because of fear associated with the chronic illness. It is important for the nurse to convey an accepting attitude to enhance mutual respect and trust. Eliminate options that are sarcastic or punitive. The only correct option is the one that respectfully addresses the concern presented by the client. A client with a diagnosis of depression who has attempted suicide says to the nurse, "I should have died. I've always been a failure. Nothing ever goes right for me." Which response by the nurse demonstrates therapeutic communication? 1. You have everything to live for. 2. Why do you see yourself as a failure? 3. Feeling like this is all part of being depressed. 4. You've been feeling like a failure for a while? Answer. 4. You've been feeling like a failure for a while? Rationale. Responding to the feelings expressed by a client is an effective therapeutic communication technique. The correct option is an example of the use of restating. The remaining options block communication because they minimize the client's experience and do not facilitate exploration of the client's expressed feelings. In addition, use of the word "why" is non-therapeutic. 2. During a therapy session, a client with a personality disorder says to the nurse, "You look so nice today. I love how you do your hair. And I love that perfume you're wearing." Which response by the nurse would best address this breach of boundaries? 1. Thank you, the perfume was a gift. 2. Your comment is really inappropriate. 3. Neither my hair nor my perfume is the focus of today's session. 4. The focus of today's session is on your issues, so let's get started. Answer. 4. The focus of today's session is on your issues, so let's get started. Rationale. The therapeutic response by the nurse is the one that clarifies the content of the client's statements and directs the client to the purpose of the session. The nurse should confront the client verbally regarding the inappropriate statements and refocus the client back to the issue of the session. Avoid options that may be judgmental and may provide an opening for a verbal struggle or those that are a social response and could be misinterpreted by the client. The nurse is preparing to create a care plan for a client admitted to the mental health unit with a diagnosis of obsessive-compulsive disorder. The nurse should plan to include which component as a priority in the plan of care. 1. The medical diagnosis of the client. 2. Individualized goals and objectives. 3. Attendance at group therapy sessions. 4. Self-care measures to improve hygiene. Answer. 2. Individualized goals and objectives. Rationale. The priority would be to develop individualized goals and objectives in the plan of care. Goals and objectives are a mutual working tool between the client and the nurse. Although the medical diagnosis of the client is considered in planning care, it is not specifically a component of a nursing care plan. Attendance at group therapy sessions and promotion of self-care measures may be components of the plan of care, but these interventions would follow after development of the goals and objectives. A client diagnosed with terminal cancer says to the nurse, "I'm going to die. And I wish my family would stop hoping for a cure. I get so angry when they carry on like this. After all, I'm the one who's dying." Which response by the nurse is therapeutic? 1. Have you shared your feelings with your family? 2. I think we should talk more about your anger with your family. 3. You're feeling angry that your family continues to hope for you to be cured? 4. You are probably very depressed, which is understandable with such a diagnosis. Answer. 3. You're feeling angry that your family continues to hope for you to be cured? Rationale. Restating is a therapeutic communication technique in which the nurse repeats what the client says to show understanding and to review what was said. While it is appropriate for the nurse to attempt to assess the client's ability to discuss feelings openly with family members, it does not help the client to discuss the feelings causing the anger. The nurse's direct attempt to expect the client to talk more about the anger is premature. The nurse would never make a judgment regarding the reason for the client's feeling. This is non-therapeutic in the one-to-one relationship. The nurse should be prepared to manage which occurrence unique to the abuse of hallucinogenic drugs. 1. Flashbacks. 2. A motivational syndrome. 3. Enhanced physical strength. 4. Absence of pain perception. Answer. 1. Flashbacks. Rationale. Flashbacks, the recurrence of perceptual distortions, are unique to the use of hallucinogenic drugs. Enhanced physical strength and the inability to feel pain are indicative of phencyclidine use, whereas marijuana abuse can result in a motivational syndrome. The nurse employed in a hospital is waiting to receive a report from the laboratory via the facsimile, fax, machine. The fax machine activates and the nurse expects the report, but instead receives a sexually oriented photograph. Which is the most appropriate initial nursing action? 1. Call the police. 2. Cut up the photograph and throw it away. 3. Call the nursing supervisor and report the occurrence. 4. Call the laboratory and ask for the name of the individual who sent the photograph. Answer. 3. Call the nursing supervisor and report the occurrence. Rationale. Ensuring a safe workplace is a responsibility of an employing institution. Sexual harassment in the workplace is prohibited by state and federal laws. Sexually suggestive jokes, touching, pressuring a coworker for a date, and open displays of or transmitting sexually oriented photographs or posters or examples of conduct that could be considered sexual harassment by another worker and is an abusive behavior. If the nurse believes that he or she is being subjected to unwelcome sexual conduct, these concerns should be reported to the nursing supervisor immediately. Option 1 is unnecessary at this time. Options 2 and 4 are inappropriate initial actions. A client is preparing to attend a Gamblers Anonymous meeting for the first time. The nurse should tell the client that which is the first step in this 12-step program. 1. Admitting to having a problem. 2. Substituting other activities for gambling. 3. Stating that the gambling will be stopped. 4. Discontinuing relationships with people who gamble. Answer. 1. Admitting to having a problem. Rationale. The first step in the 12-step program is to admit that a problem exists. Substituting other activities for gambling may be a strategy, but it is not the first step. The remaining options are not realistic strategies for the initial step in a 12-step program. A client admitted to the mental health unit after attacking his father for disturbing him at his computer interrupts the nurse during morning rounds and says, "I need to get out of here so I can work on my computer project to save the world." Which nursing response will have the greatest therapeutic impact? 1. I will be back to talk with you in 15 minutes after I complete nursing rounds. 2. You hurt your father, and you won't leave here until you can control yourself better. 3. You have a project to save the world? I'd really like to hear about that after I finish rounds. 4. Well, sit right down and eat your breakfast. You're not going to save the world on an empty stomach. Answer. 1. I will be back to talk with you in 15 minutes after I complete nursing rounds. Rationale. The therapeutic response is one that sets limits on the client's interruptive behavior and assesses the client's ability to control his behavior. The correct response sets reasonable, attainable expectations for the client. It is not therapeutic for the nurse to support the client's delusional system. The nurse should not engage in a playful and mothering type of social response, which may escalate the client's behavior, nor should the nurse chastise the client for behavior that was not within the client's control. A client gives the home health nurse a bottle of clomipramine. The nurse notes that the medication has not been taken by the client in 2 months. Which behavior observed in the client would validate noncompliance with this medication? 1. Complaints of insomnia. 2. Complaints of hunger and fatigue. 3. A pulse rate less than 60 beats per minute. 4. Frequent hand washing with hot, soapy water. Answer. 4. Frequent hand washing with hot, soapy water. Rationale. Clomipramine is a tricyclic antidepressant used to treat obsessive-compulsive disorder. Sedation sometimes occurs. Insomnia seldom is a side effect. Weight gain and tachycardia are side and adverse effects of this medication. When discussing an individual's tendency to substance abuse, the nurse should identify which assessment data as a primary biological factor. 1. The client is a 25-year-old male. 2. The client is employed as a firefighter. 3. The client is of German ethnic background. 4. The client has 2 family members who have abused. Answer. 4. The client has 2 family members who have abused. Rationale. Family history of substance abuse is considered the key biological factor in affecting individual abuse. The remaining options do not have the same degree of effect as does the correct option. A client with a diagnosis of anorexia nervosa, who is in a state of starvation, is in a 2-bedroom. A newly admitted client will be assigned to this client's room. Which client would be the best choice as a roommate for the client with anorexia nervosa? 1. A client with pneumonia. 2. A client undergoing diagnostic tests. 3. A client who thrives on managing others. 4. A client who could benefit from the client's assistance at mealtime. Answer. 2. A client undergoing diagnostic tests. Rationale. The client undergoing diagnostic tests is an acceptable roommate. The client with anorexia nervosa is most likely experiencing hematological complications, such as leukopenia. Having a roommate with pneumonia would place the client with anorexia nervosa at risk for infection. The client with anorexia nervosa should not be put in a situation in which the client can focus on the nutritional needs of others or be managed by others, because this may contribute to sublimation and suppression of personal hunger. A client diagnosed with schizophrenia says to the nurse, "Will you protect me from the Grand Duchess?" and points to an older client who is sitting reading a book. Which statement is the therapeutic response by the nurse? 1. Where is she? I'll talk to her. 2. I can see no Grand Duchess. You will need to trust me on that. 3. You will be safe here. Your thinking will be clearer after your medication starts to work. 4. The Grand Duchess, huh? Well, I'm the Queen, and I will order her to stay away from you. Answer. 3. You will be safe here. Your thinking will be clearer after your medication starts to work. Rationale. The schizophrenic client is making a paranoid statement. It is important that the nurse provide the client with a supportive and protective intervention. The correct option is the only one that reflects a therapeutic technique, presents reality, and addresses safety. To ask, "Where is she? I'll talk to her," is not therapeutic because the nurse feeds into the client's psychosis by asking where the fantasy client is. To state that the nurse does not see the Grand Duchess and that the client needs to trust the nurse begins by presenting reality. but it does not demonstrate any real support for the client's concern with safety. To say that the nurse is the queen and will order the Grand Duchess to stay away is sarcastic and belittling to the client. A client diagnosed with schizophrenia has a new prescription for risperidone. Which baseline laboratory results should the nurse review before administering the first dose of this medication? 1. Platelet count. 2. Blood clotting tests. 3. Liver function studies. 4. Complete blood count. Answer. 3. Liver function studies. Rationale. Risperidone is an atypical antipsychotic. A baseline assessment of renal and liver function should be done before the initiation of therapy with risperidone. The medication is used with caution in clients with renal or hepatic impairment, in those with underlying cardiovascular disorders, and in geriatric or debilitated clients. These clients are started on the medication at a reduced dosage level. None of the other diagnostics are relevant to this medication. Client says to the nurse, "The federal guards were sent to kill me." Which is the best response by the nurse to the client's concern? 1. I don't believe this is true. 2. The guards are not out to kill you. 3. Do you feel afraid that people are trying to hurt you? 4. What makes you think the guards were sent to hurt you? Answer. 3. Do you feel afraid that people are trying to hurt you? Rationale. It is most therapeutic for the nurse to empathize with the client's experience. The remaining options lack this connection with the client. Disagreeing with delusions may make the client more defensive, and the client may cling to the delusions even more. Encouraging discussion regarding the delusion is inappropriate. The nurse observes that a client is pacing, agitated, and presenting aggressive gestures. The client's speech pattern is rapid, and affect is belligerent. Based on these observations, which is the nurse's immediate priority of care? 1. Provide safety for the client and other clients on the unit. 2. Provide the clients on the unit with a sense of comfort and safety. 3. Assist the staff in caring for the client in a controlled environment. 4. Offer the client a less stimulating area in which to calm down and gain control. Answer. 1. Provide safety for the client and other clients on the unit. Rationale. Safety of the client and other clients is the immediate priority. The correct option is the only one that addresses the safety needs of the client as well as those of the other clients. The nurse is creating a discharge plan for the family of a client diagnosed with a mood disorder. The nurse should plan to provide which priority information to the family? 1. Brain anomalies that are responsible for this disorder. 2. Signs that indicate the client may be considering suicide. 3. The importance benzodiazepines play in the management of this disorder. 4. The possibility that the client will experience medication-induced tinnitus. Answer. 2. Signs that indicate the client may be considering suicide. Rationale. Suicide is the most serious concern for clients with mood disorders. Early identification of behaviors that reflect the client's suicidal mindset is vital to minimizing the risk of self-injury and/or death. Mood disorders are not typically a result of brain anomalies. Benzodiazepines are not the medication classification of choice for treating mood disorders. Tinnitus is not a typical side effect of antidepressant medication therapy. The client diagnosed with depression says to the nurse, "I haven't had an appetite at all for the last few weeks." Which response by the nurse best assesses the client's nutritional issue? 1. The last few weeks? 2. You haven't had an appetite at all? 3. Have patience. It will take time for your appetite to improve. 4. When the medication begins to work, your appetite will return. Answer. 2. You haven't had an appetite at all? Rationale. The therapeutic communication technique is restatement. Although it is a technique that has a prompting component to it, it repeats the client's major theme, which helps the nurse obtain a more specific perception of the problem from the client. The length of time is not as relevant as defining what the nutritional issue actually involves. The other options minimize the client's concerns about eating. Eliminate options that fail to focus on the nutritional issue or block the communication process by minimizing the client's concern. A client states to the nurse, "My life has been such a failure. Nothing I do turns out right." Which response by the nurse will best address the client's low sense of self-esteem? 1. You can't really believe that about yourself. 2. I know just how you feel. I have those days myself once in a while. 3. I disagree with you. We all have some value and accomplishments in life. 4. You seem very discouraged. Let's identify something that you are proud of doing. Answer. 4. You seem very discouraged. Let's identify something that you are proud of doing. Rationale. Depressed clients frequently exhibit feelings of low self-esteem and worthlessness. An effective plan of care should be designed for the client to provide experiences that are challenging but successful to enhance the client's self-esteem. Reminders of the client's past accomplishments or personal successes are ways to interrupt the client's negative self-talk and distorted cognitive view of self. The nurse should not devalue the client's feelings or challenge the client's statements. The nurse should not focus on oneself. The spouse of an alcoholic client is attending a support group and says to the group members, "It's all very well for everyone to label me an enabler, but if I didn't call him in sick at work, he'd lose his job. Where would we be then?" Which statement by the nurse co-leader would be therapeutic? 1. Does anyone in the group want to respond to that? 2. So you only call him in sick because you are worried about money? 3. Hasn't the group discussed this before? What conclusion did you all come to? 4. It is a difficult situation. But do you agree that enabling creates codependency? Answer. 4. It is a difficult situation, but do you agree that enabling creates codependency? Rationale. The therapeutic response is the one that seeks clarification and assesses the client's understanding of the dynamics of codependency. The nurse should never belittle a client or inappropriately place the burden of responding on the group members. When the nurse changes the focus to money by reinterpreting the client's denial, the intervention is prematurely timed. The nurse is caring for a client diagnosed with schizophrenia who states, "I decided not to take my medication because I realized that it really can't help me. Only I can help me." Which question asked by the nurse has the best therapeutic value? 1. Why do you think this is a wise decision? 2. I don't understand. Only you can help you? 3. You've decided not to take your medication. Is that right? 4. Do you recall what it was like before you started your medication? Answer. 4. Do you recall what it was like before you started your medication? Rationale. Non-compliance with antipsychotic medication is one of the chief reasons that clients with schizophrenia have relapses. The most therapeutic response is to initiate a conversation with the client directed toward discussing the disadvantages of being non-compliant. While it is therapeutic to use communication techniques like restating and clarification, it is not useful to this client since the intent of the behavior is already understood. Asking a why question is usually viewed as argumentative by the client and so is not therapeutic. The home health nurse visits a client at home and determines that the client is dependent on drugs. During the assessment, which action should the nurse take to plan appropriate nursing care? 1. Ask the client why he started taking illegal drugs. 2. Ask the client about the amount of drug use and its effect. 3. Ask the client how long he thought that he could take drugs without someone finding out. 4. Do not ask any questions for fear that the client is in denial and will throw the nurse out of the home. Answer. 2. Ask the client about the amount of drug use and its effect. Rationale. Whenever the nurse carries out an assessment for a client who is dependent on drugs, it is best for the nurse to attempt to elicit information by being non-judgmental and direct. Option 1 is incorrect because it is judgmental and off-focus, and reflects the nurse's bias. Option 3 is incorrect because it is judgmental, insensitive, and aggressive, which is non-therapeutic. Option 4 is incorrect because it indicates passivity on the nurse's part and uses rationalization to avoid the therapeutic nursing intervention. The nurse is caring for a client just admitted to the mental health unit and is displaying immobile and mute behaviors and is withdrawn. The client is lying on the bed in a fetal position. Which is the most appropriate nursing intervention? 1. Ask direct questions to encourage talking. 2. Leave the client alone so as to minimize external stimuli. 3. Sit beside the client in silence with occasional open-ended questions. 4. Take the client into the day room with other clients so that they can help watch them. Answer. 3. Sit beside the client in silence with occasional open-ended questions. Rationale. Clients who are withdrawn may be immobile and mute and may require consistent, repeated approaches. Communication with withdrawn clients requires much patience from the nurse. Interventions include the establishment of interpersonal contact. The nurse facilitates communication with the client by sitting in silence, asking open-ended questions rather than direct questions, and pausing to provide opportunities for the client to respond. While overstimulation is not appropriate, there is no therapeutic value in ignoring the client. The client's safety is not the responsibility of other clients. A preoperative client expresses anxiety to the nurse about upcoming surgery. Which response by the nurse is most likely to stimulate further discussion between the client and the nurse? 1. If it's any help, everyone is nervous before surgery. 2. I will be happy to explain the entire surgical procedure to you. 3. Can you share with me what you've been told about your surgery? 4. Let me tell you about the care you'll receive after surgery and the amount of pain you can anticipate. Answer. 3. Can you share with me what you've been told about your surgery? Rationale. Explanations should begin with the information that the client knows. By providing the client with individualized explanations of care and procedures, the nurse can assist the client in handling anxiety and fear for a smooth preoperative experience. Clients who are calm and emotionally prepared for surgery withstand anesthesia better and experience fewer postoperative complications. Option 1 does not focus on the client's anxiety. Explaining the entire surgical procedure may increase the client's anxiety. Option 4 avoids the client's anxiety and is focused on postoperative care. A hospitalized client experiencing delusions reports to the nurse, "I know that the doctor is talking to the top man in the mob to get rid of me." Which response should the nurse make to the client? 1. I don't believe this is true. 2. The doctor is not talking to the mob. 3. Do you feel afraid that people are trying to hurt you? 4. What makes you think the doctor wants to get rid of you? Answer. 3. Do you feel afraid that people are trying to hurt you? Rationale. When delusional, a client truly believes what he or she thinks to be real is real. The client's thinking often reflects feelings of great fear and aloneness. It is most therapeutic for the nurse to empathize with the client's experience. Disagreeing with delusions may make the client more defensive, and the client may cling to the delusions even more. Encouraging discussion regarding the delusions is inappropriate. The husband of an alcohol-dependent wife says, "If anyone had said I'd be henpecked, I'd have called them a liar. But now I realize that I'm codependent." Which statement by the nurse would be therapeutic? 1. Did you know that more people identify with just what you are saying? 2. Which of the features that describe codependence caused you to recognize that? 3. Can you tell me more about that? You see yourself as being codependent with your wife? 4. Have you discussed your feelings with your wife? What does your wife think about what you've said? Answer. 3. Can you tell me more about that? You see yourself as being codependent with your wife? Rationale. This question describes the husband of an alcohol-dependent wife who is developing awareness of his codependency. Codependency consists of an individual's becoming preoccupied with the needs and concerns of another to the exclusion of his or her own needs. The therapeutic statement seeks clarification and summarizes and focuses the client on his own concerns and discoveries. When the nurse provides a social response that is non-therapeutic, it does not focus on the client's feelings. Intellectual questioning does not facilitate expression of feelings. Asking questions that are off focus from the client's feelings are non-therapeutic because they constitute probing. The nurse will gather this information, but by gaining the trust of the client, not by probing. A client is admitted to the mental health unit with a diagnosis of depression. The nurse should develop a plan of care for the client that includes which intervention? 1. Encouraging quiet reading and writing for the first few days. 2. Identification of physical activities that will provide exercise. 3. No socializing activities until the client asks to participate in milieu. 4. A structured program of activities in which the client can participate. Answer. 4. A structured program of activities in which the client can participate. The nurse is creating a plan of care for a client diagnosed with depression whose food intake is poor. The nurse should include which interventions in the plan of care? Select all that apply. 1. Assist the client in selecting foods from the food menu. 2. Offer high-calorie fluids throughout the day and evening. 3. Allow the client to eat alone in the room if the client requests to do so. 4. Offer small high-calorie, high-protein snacks during the day and evening. 5. Select the foods for the client to be sure that the client eats a balanced diet. Answer. 1. Assist the client in selecting foods from the food menu. 2. Offer high-calorie fluids throughout the day and evening. 4. Offer small high-calorie, high-protein snacks during the day and evening. Rationale. In caring for a client with depression whose nutritional intake is poor, the nurse should remain with the client during the meal. The nurse also should assist the client in selecting foods from the menu because the client is more likely to eat the foods that he or she likes. Offering small high-calorie, high-protein snacks and high-calorie fluids throughout the day and evening are appropriate interventions for the client to maintain nutrition. The nurse creating a plan of care for the client demonstrating paranoia should include which interventions in the plan of care? Select all that apply. 1. Ask permission before touching the client. 2. Provide a warm, social approach to the client. 3. Eliminate all unnecessary physical contact with the client. 4. Diffuse any anger or verbal attacks with a non-defensive stance. 5. Use simple and clear language when communicating with the client. Answer. 1. Ask permission before touching the client. 3. Eliminate all unnecessary physical contact with the client. 4. Diffuse any anger or verbal attacks with a non-defensive stance. 5. Use simple and clear language when communicating with the client. Rationale. When caring for a client with paranoia, the nurse should ask permission if touch is necessary because touch may be interpreted as a sexual or physical assault. The nurse must eliminate any physical contact and not touch the client unless necessary and with the client's permission. The anger that a paranoid client expresses often is displaced. And when a staff member becomes defensive, both client and staff anger may escalate. Simple and clear language should be used in speaking to the client to prevent misinterpretation and to clarify the nurse's intent and action. The nurse should avoid a warm approach because warmth can be frightening to a person who needs emotional distance.